Yeah, I think you could start. And if others come, they can join later and they can watch the video. Yeah. So,
Sounds great. Okay. Hello, everyone. Welcome to my presentation. My name is Soyoung, and today I'll be talking about AI and substance addictions, and what the future of treatment for substance abuse will look like. Okay. So I will be talking about what substance use disorder is, my community, which is the homeless community. I've got the okay to talk specifically about my role in the community and the services that we offer. So I'll be talking about that. And then the last component of the presentation will deal with artificial intelligence and substance use disorder. Oops, that is the wrong, mistake on the presentation. This definition of substance use disorder is actually not by CDSS. It's by the American Society of Addiction Medicine.
okay.
So substance use disorder is defined as a treatable chronic medical disease involving complex interactions among brain circuits, genetics, and the environment and the individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. So substance abuse is a major cause in disabilities and can lead to death if untreated or inadequately treated. So the factors that go into contributing substance abuse is genetics, which makes up the 50% of the reasons why people may develop addictions, underlying biological deficits, getting into habits, experiencing trauma and other overwhelming stressors, cognitive and affective distortions, and mental illness all contribute as a factor to substance abuse. And the ways in which we can identify addictions is through the ABCDE, which is inability to abstain, impairment in behavioral control, cravings, diminished recognition of significant problems, and dysfunctional emotional response. The tricky part of substance abuse is that there is a persistent risk of relapse. So it is quite difficult to address because there are so many factors that can contribute to relapsing. Being triggered, such as like external cues, or being surrounded by substances such as alcohol. Our culture of like the party culture can contribute to the relapse, and so on. Substance abuse causes impairment in executive functioning and impacts both cognitive, emotional, and behaviors of the patient. There are two main ways that substance abuse is intervened, and that's legal and clinical intervention. So due to the nature of addictions, a lot of times it is really tied in deeply with crimes such as gang violence, drug dealing, human trafficking, and stuff like that. So the criminal justice system is always involved and works to intervene to keep people accountable and reduce crime activities. A really good example of this is Drug Court in Edmonton, which works with Edmonton John Howard Society and the criminal justice system together. basically people that get convicted under the drug court for possession of drugs or use of drugs or dealing, they will go through a program where they have to complete addiction treatment. The other legal interventions are Good Samaritan Drug Overdose Act. So you won't be criminally charged if you overdose by using. And another way to mitigate and prevent overdoses is the Controlled Drugs and Substances Act. It just puts a stricter emphasis on reducing the amount of like fentanyl coming in to across the borders and stuff like that. Clinical intervention focuses on brain health and getting medications and tending to the mental health as well. So commonly it goes from detox. Someone will go into detox where they'll be able to have safe withdrawals, and then they move on to stage 1 and then stage 2 recovery treatment. As in other health conditions, self-management with mutual support is really crucial when it comes to recovery from substance abuse. So a major focus in addressing substance abuse is also addressing the needs and not just the drug addictions of the patient. So that could include making sure that they access ID services, so they have a healthcare card or ID card, and getting housing and employment if that is something that they do not have, and accessing counseling and therapy for their mental health. Commonly with substance abuse disorders, other chronic health issues and diseases occur at the same time. A really good example of this is HIV, especially for those who use IV drugs. So that's usually part of the treatment programs. And as a lifelong journey, recovery is a lifelong journey. There is a big emphasis on relapse prevention and how to get back up after you relapse and continuing care through counseling and checkups and continuing addressing other physical issues that may be needed, and also having a community where you can build relationships such as AA. So moving on, my community is the Edmonton's homeless community. My role in the community at this time, I work on the crisis diversion team at Bull Street Community Services. I'm the person that drives, either me or my partner will drive when we get a call through 211. So my program is really unique because we do outreach and we remove the barriers of transportation that our community members usually does not have access to. And we work in collaboration and in partnerships with different larger agencies external to our organization. Sorry, that was my cat. External to my organization. So within my community, although it is very vibrant, I've met one of the best peoples I've ever met and have the best conversations I've ever had while working. We do have issues of substance abuse. There's really, really, really deep trauma that stems from the homeless community. A lot of my community members do not have access to basic needs. So there is a factor of social determinants of health. And also other factors such as the environment, the living conditions, the constant exposure to violence and trauma and addictions really have an impact on the well-beings and the health of the community, including the staff, police, and healthcare workers and first responders. We do have gang presence, so there is always violence. And because of the depth of addictions that exist, our community members do sometimes struggle with controlling their emotions. So sometimes we will run into violent behaviors, but all the staff should and is really good with non-violent crisis intervention. On top of that, we also face systemic and institutional and social barriers. One of the ways in which the cycle of abuse and addictions and violence continues to turn is due to access. Our community members, because we face such unique barriers, we have difficult time accessing resources that would be quite beneficial. Our community members also face a lot of burnout. And while working through recovery and treatment, they find it quite difficult and often run into burning out from their treatment. It is also really interesting to think about, because if you're homeless and you're constantly in this environment filled with trauma and violence, while you're trying to complete your treatment and achieve whatever recovery goals that person may have, it's not actually quite sustainable with the lifestyle and the environment and the patterns that you experience. So this little picture it just says everything around is built for people not like us. So that's just kind of shows from a firsthand account of frustrations that our community members face. So these illustrations are done by one of my coworkers, and their Instagram handle for this page is called Drawings from the Dropin. Basically what it is he will kind of do illustrations and quotes that he has heard that day working in the Dropin, or through having conversations with our community members. So the first one says, yeah, drugs are a crutch, but crutches help you walk. When you do meth, you feel confident and smart and beautiful. Line up to get inside, line up for a bed, line up for the phone, line up for the bathroom. I just wanted to include this in there in this presentation, just to give you guys an idea of why our community members may continue to choose to use over recovery, and why someone may be choosing to use, and what benefits they might get, and the experiences of what it means to be living on the streets. Obviously, substance abuse has more negative impacts than a positive, if we were to really weigh it that way. And I did include this just to defend the use of drugs as a coping mechanism. It is unhealthy. It is not recommended. Don't do drugs in an abusive manner. But it is important for us to know where these people are coming from, and why at this time, when they are unable to access technologies and resources for recovery, why they just continue to choose to use. So I just wanted to include that in there. So to assist our community members in living a better quality, having a better quality of life, there are some programs that are interdisciplinary. So housing, physical health, mental health, and cultural support often all work together for one patient or client that we have. We will address the housing issue, getting them into the program of housing first. The health part includes having safe supplies, addressing HIV or other chronic illnesses such as brain damage that follows from living in the homeless community. Mental health support, just because our community members have really deep levels of trauma that needs to be worked on and uncovered and reconciled with, and cultural support because we have a disproportionate representation of Indigenous population within the homeless community. They make up about 51% according to a survey completed in 2016 by Homer Trust, which is an agency that focuses on ending homelessness. And the root causes of that is because of colonialism and intergenerational trauma that follows and the continuation of colonialism. There are collaborations between community agencies and stakeholders. So for example, the Edmonton Convention Center right now is operating as a 24/7 shelter. And under the same roof, there is Oil Street Community Services, there is Bissell Center, there are nurses that work, paramedics that work there. There are folks that work run programs for employment. So everything is under one roof where people are able to access showers, programs, meet up with their workers, and have 3 meals a day and a bed at the end of the night. Another really important and probably the common practices that we use in approaching addictions within the homeless community is harm reduction. So harm reduction is evidence-based best practice. It recognizes that individuals do not fit under one specific category when it comes to recovery. So abstinence-based practices obviously work for some people, and that's great, but it is usually not the case, and it's difficult for someone to transition from being addicted to meth to completely becoming sober even in a matter of a year. So to prevent and specifically deal with the opioid crisis that we are going through in the homeless community, we have the safe consumption sites, naloxone, medication-assisted treatment, and managed alcohol program. So safe consumption site is where it's staffed by nurses and paramedics, and it's where a client can come in and use whatever drug of choice, and then be monitored so that there is a less likely chance of overdosing, or have access to a clean space that they can use. Naloxone is something that we use quite often. It basically reverses the effects of an overdose on an opioid. So usually this is something that has come to be more easily accessible and known in the broader general community, which is really great. But even with naloxone, the person that gets administered with naloxone has a risk of overdosing again in the next 30 minutes. Methadone and Suboxone is now a common use. And one of the ways that we try to encourage community members to access methadone and Suboxone are the examples. Usually community members who have support workers will refer them to or assist them in getting a prescription of medication, but our community members do struggle with maintaining and being consistent with this treatment just because it can get stolen so fast, they can lose it, there's no safe space to store it, and they would have to go to a pharmacy or go to a clinic to access this type of treatment. And sometimes that can be a barrier for our community members. Managed alcohol program is actually really cool because it provides a safe supply of an actual substance. This is done by providing whoever is part of this program with alternatives to mouthwash and hand sanitizer and just straight up ethanol. So the clients will receive wine or beer and it's funded, which is actually quite nice. So they will have access to that. Moving on to artificial intelligence and addictions. Artificial intelligence is actually quite useful when it comes to healthcare, just because it aids in closing the gaps of resources and treatment provided to the patient. It increases availability and access and can reduce the amount of time that it would take for someone to get admitted and access recovery treatment programs and services. So at this time, you have to apply to go into detox. And then when you're in there, you have to apply to go into first stage recovery treatment centers. And when there's a wait list, but to do that, you need to get ID, you need to fill out paperwork, you have to fill out consent forms. There are lots on both the community members and the other community members who are staff in assisting and actually getting the person to a program. And during those times, especially within the homeless community, there are more ways for them to relapse, and then they have to redo the detox, and then they have to reapply and everything. So it just a faster and shortened time in wait times would actually create more successful and positive outcomes. It also gives the sector an opportunity for professional development to better serve the community that we serve. And it works to find new ways to better accommodate people with multiple chronic diseases. We already kind of see incorporation of artificial intelligence when we're dealing with addictions. So digital technologies such as apps on your phone, virtual reality, and softwares actually help with better outcomes, and we already see that. For example, let's say I am an alcoholic, but I cannot commit to recovery because I have to go to work so that I can pay for my bills and food and take care of myself. Having access to virtual reality programs or applications on my phone where I can access treatment and mental health coaching and resources lessens the strains on the commitment that I would have to make. I wanted to include software and databases in this because it actually helps us a lot, us as in, I mean, staff, when it comes to communication, and also doing client files instead of handwriting it. We can all upload it onto our database, and more agencies would have access, and there will be better communications flowing from the staff of the internal organization and different programs, but also external programs and agencies can also look at the database and really see what's happening in the day-to-day lives of our community members. So big data and artificial intelligence can contribute to early detection of addictions as a preventative measure. New drug discovery can aid in medication-assisted treatment. And the research that comes out from big data and artificial intelligence supports care providers in what the best practice of care looks like. Data analytics and machine learning also plays a really important role. It can help assist clients with pain management solutions, about prescription management, how to deter someone from abusing their prescriptions, and also more resources on navigating through drug theft. As I've mentioned, it's really common for prescription medication to be utilized as a form of currency, or it gets stolen. And that's a really difficult thing to mitigate, especially within our community, because we can't really point fingers and hold them accountable. So being able to at least get rid of that problem of drug theft, it will also reduce the amount of overdoses that may happen, and that prescription being utilized to or consumed to feed another person's addiction. It also is really beneficial because it will provide greater insight to addictive behaviors. So predictive analytics and digital tools can be utilized to see patterns and behaviors of addictions or an individual's addictive behaviors, and it can be utilized to cater what the person and their treatment for them. So moving on. Oh, one thing that I forgot to mention is that the utilization of artificial intelligence when it comes to treating substance abuse, it provides the people providing care to address the primary causes of abuse, and then also offers patients a form of support in their recoveries. Obviously, there are some concerns when it comes to this. Oftentimes, people who struggle with addictions have a difficult understanding of what it means to have healthy relationships, not just with people, but with technologies, with food, with things that they are surrounded by. Often when someone achieves sobriety and abstinence, they will start eating a lot of sugar. Or someone will be in the process of recovering because a lot of times it stems from trauma. They might be repeating the trauma that they have experienced and traumatize other people. So a concern is dependency and transfer of addictions. But I think this can be mitigated through counseling and therapy and other forms of working on addressing relationship issues. So we need to also be able to kind of remove not only, sorry, let me restart that. There needs to be a focus on not just AI and new technologies taking over what we are currently providing, but including AI and technologies part of the circle of relationships in order to achieve positive treatment outcomes and management of addictions. There is also concern of integration of new technologies into practice. So this could look like staff who works at a center having difficulty working with a new program, or a client being hesitant in including technology as part of their treatment program. But I think this can be mitigated through collaboration. And what I mean by that is including not only those that are providing care, but also those that are receiving care when we are developing and building new practices and policies and procedures through education and training, and not just to the professionals, but also to the people that we serve. There is also the concern of neocolonialism. Because especially in the homeless community, we serve a population that's disproportionately represented by Indigenous peoples. There is all who have an extensive history of experiencing eugenics and unfair treatment within the healthcare system, and having their bodies being used as tools for research and betterment and progress of science and practices. So we always have to be, I think it just makes sense for us to recognize that there is an issue currently because of colonial practices within the colonial state of Canada. And to mitigate that, we need to really focus on decolonizing our practices and how we do research when it comes to sciences and medicine and healthcare. So that could look like including more Indigenous researchers, more Indigenous practitioners, taking a culturally informed practice and approach when we're doing counseling and therapy, and developing technologies that align with those values. And it could also include including practices and programs that is built and practiced by Indigenous peoples, so that a big part of our community can actually be able to reconcile and find strength from the historical trauma that continues. So we're approaching the end of the presentation, and I just wanted to talk about innovations and ideas of addressing substance abuse, with the development of technology. So one of the ways that, one of the common ways that people access resources is through digital technology. And within the homeless community, phones, computers, and any type of digital technologies are used as a form of currency. So, and when someone does have a phone, they run into the issue of not having anywhere to charge their phones, or their phones being really old and, are flip phones, and they are really not able to keep it up to date. So phone charging station is one way to mitigate this issue. And with automation, we could create automated mass production of resources, and maybe those resources could be utilized towards building shelters that are more accessible, and building more facilities that could provide care. And then these are just two of my little thoughts. I thought it would be really cool if we could have like an implant that we inject into the patient's body that would slowly release medication for treatment. So as I've mentioned, drug theft and losing medication, being able to not go to a pharmacy to get your medication are big barriers for people to have a consistent and sustainable medication treatment. So within the current state, it would be really cool if they could just have like an implant, like a hormonal IUD, similar to that idea, where it would kind of slowly release medication into someone's system. And super drug, maybe we could take just one medication, and it would really address maybe not all, but like majority of physical and mental health issues. Sometimes taking medication can be triggering for our community members, and I guess this also ties into implants as well. The act of taking medication can be triggering for that person as a practice of their rituals when they are feeding their addictions, right? And I also wanted to hear if there are any other innovations and ideas that you guys have that I haven't been able to think about, and we can talk about that at the very end. So I wanted to provide some resources. Number one is calling 211 and pressing 3. You will be able to reach a 211 dispatcher, and that person, the dispatcher, will dispatch a call to the crisis diversion team. Our services include transportation and wellness checks, and sometimes mental health calls. The crisis diversion team really works hard to close the gaps for the barriers of transportation that our community members may face. Let's say like someone's really intoxicated and is unable to make it safely to a shelter, we will assist them with that. If someone is needing to go to the hospital, but does not have a way to go to the hospital, we will help with the transportation. The Boyle Street Crisis Diversion Team carries harm reduction supplies, so that's clean needles, supplies such as like alcohol swabs, ties, and sharps container. We also provide basic supplies like water and granola bars, whereas the Hope Mission Crisis Diversion Team, often also called as the rescue van, they have meals, and they're currently during this pandemic responding and attending to all the COVID-19 calls. And they've been working really hard and keeping our community safe. So it's really great. Another program is the Needle Exchange Program. It does education and provides clean and safe supplies for the community members to use. Naloxone. I can't emphasize how important and crucial naloxone has been in addressing the current opioid crisis. It is obviously the first step to addressing substance abuse, as is a lot of the harm reduction practices are. These are all very first steps. But naloxone is really important because you can't achieve recovery if you're dead. So briefly outlining, you can get naloxone without an ID at a pharmacy. You can also grab it from Bull Street. And there's a little pamphlet and you can go look into it. It's quite simple. And the signs of overdoses are the commonly known ones are that someone's not breathing, they're turning blue. If they are making noise, it might sound like they're gurgling and their breath is really shallow. Sometimes it sounds like they're snoring, but that's because their tongue is kind of getting in the way and air does its things in science and it just sounds like a snore. And pinned pupils. During the pandemic, we are not doing chest compressions and we're not doing mouth to mouth. I forget what it is, but we're not doing rescue breaths just because of the risk of COVID-19. I always have naloxone with me. It makes you look cool. I think it makes me look cool when I have it slung on my fanny pack, and it definitely helps a lot. But as you are responding to an overdose, one of the first steps while getting your syringe ready for the injection is also calling 911. And then if you are taking a stroll downtown or in the River Valley or White Ave or wherever, and you see a needle, you just call 311 for needle collection. And during non-business hours, it actually gets transferred to the crisis diversion team, and then we'll come and pick up needles. We don't clean up after drug paraphernalia, but we come and pick up the needles, which is technically a biohazard. Any questions, comments, anything you guys would like for me to elaborate on? That is the end of the presentation.
Why don't you stop screen sharing so we can see each other a bit here? Yeah. Cool.
Yeah.
Okay. So any questions, comments? Yeah, I think this is an important part of the world around us that most of us know very little about. In the hospital, there are naloxone signs everywhere. Walk in and get a kit, but that doesn't mean that people know very much about the situation.
Yeah. I wanted to do my part as an ally to the homeless community to provide the realities of what it actually although this is very brief and very condensed, to really bring this to attention, because my community is the community that needs these technologies the most. We are the ones that need the prayers the most, is one of the ways that we talk about it. And I'm really grateful for this opportunity to provide this presentation. because a lot of the folks that are going to be accessing this presentation, including you, Dr. Solas, and like the fellow classmates, are going to be the people that are in powers of positions in future, or positions of power in future. And I just ask that you guys just keep it in the back of the mind, and that it's really important. It's a social issue, but it's also really, really difficult health issue when it comes to just so many different things. So I hope that this was a bit informative.
I think many of the proposed uses of artificial intelligence fall in a category of even the humans doing those things, that it's hard to provide the proper nuanced, balanced response to the encounters that you're dealing with. And so in training AI to help us, it'll make us better at this too, because we'll have to come up with formulas and stuff. Yeah, so I think it'll help in both directions. You can imagine that when a lot of things are internal inside the body, that the problem of losing things and getting things stolen is less, right? But then maybe your body becomes a container of, information about crimes that the, authorities would want to plug into your body, see what, information you have. And so, yeah, like the well-maintained cell phone of a homeless person, it's great that it's well-maintained, but the police department might find it quite useful because of all the information that it would contain, a well-maintained.
Yeah, it's really interesting, this community, just because there are just so many different ways different intersections intersect, and all at different levels. It's tricky as well because obviously everyone kind of has their own agendas almost to achieve the same goals, but the practitioners are practiced differently, and then they can sometimes come into conflict. So maybe with the use of digital technologies, like as a cell phone, as a resource for treatment, that becomes like a confidential device that police won't be able to confiscate unless they have a specific unique grounds to access it. Or maybe it would have to, I know that with some crimes, you would have to start a new investigation if you find something within the first crime. So maybe there will be a new department within the criminal justice system that would specifically handle cases like this when it comes to intersections of gangs, addictions, and digital technologies. I do think, though, the integration of technologies, especially AI, will really be useful in changing our service deliveries to better suit the needs of our community members, because we already have all these new practices and programs and all these new products that are accessible, but it's just not in terms of our community members, because it's just so unique. and they don't face just 5 barriers or challenges, they have more than that. And being part of a community that's constantly under a crisis, for example, like the opioid crisis, having additional crises come in also disproportionately impacts them. So I think it would be really beneficial in moving forward when we center the needs of the most vulnerable, because it's like a bottom up approach, right? Like if we really center the needs of the most vulnerable and marginalized populations, that will create solutions for everyone. It works up, it's a grassroots type of approach. And I think so far, a lot of the ways in which we have been approaching development in research and products and practices really leaves out the vulnerable and marginalized community, because they don't really have representation or voices or visibility. So yeah, I just wanted to shine the light.
Yeah, well, I think you've done an important service here in talking about this. I mean, it has been quite a presence within the city the whole time we've been teaching the course, but we haven't talked about it until now. So thank you very much. And I'm hopeful to have the grades available on Friday. Shauna is still grading her part of the midterm, but hopefully she'll be done with that today, and I'll be able to submit the grades tomorrow and then have them available to you on Friday. So that's the plan. I'll try to make that happen. Okay.
Could I just add one more thing?
Sure.
With the pandemic and the closure of borders, every like drug trafficking organizations, I'm sure, are facing this issue, is that there's short supplies now. So it's getting more cut. The drugs are getting more cut with additives, and we already, even before the pandemic, we already had the issue of meth. We call it meth, but it's no longer meth at the time that it comes into the hands of our community members. But throughout the COVID pandemic, the number of overdoses have spiked, and they've been getting more difficult and more difficult to actually reverse. The inner city community has the naloxone kit with the injection vials and the needles, while police and peace officers and hospitals have the nasal spray, which is more potent. But we've had instances where we've been needing to, while waiting for EMS to arrive, we've been needing to use 2 to 3 kits of naloxone, and each kit has 3 vials. So I just want to point that out, because changes of the current social transnational state really impacts the binary of life and death within this community. And I'm sure it's not just local to Edmonton. I'm sure it's everywhere, with the community having 3 to 5 times more levels of overdoses in comparison to the general public in Alberta specifically. So it's difficult, but I think it's important to start having these conversations, especially in academia, and just in lives in general, because it really can save a life, and visibility is really important.
Yeah.
That is all.
Okay, great. Well, I think that's it. And thank you very much. And yeah, many of you have asked to be TAs and to be involved in the course in the future, and that is certainly possible. And there are many roles you can have. So anyway, just wanted to add that. Okay, thank you very much.